Agent. This is Dr. Mary Telak, and this program is paid for by her office. Correct? This one is.
Yes.
How you doing?
Good. Good morning, everybody.
And I am being told this is a Facebook Live video, so I need to move over here and get a little bit closer to you so that Jimmy Mullaney, the pride of Purdue Northwest, and Bishop Knowles telling us where to sit. Oh, kind of crazy times right now, huh?
Why is that?
I think that, I did want to ask you about this, is that I think that for the average listener, person that's listening right now, they got a lot of stuff going on. First of all, the change of the season. They've got the Cubs that have won the World Series. That is a very emotional roller coaster for a lot of people. And then you have the stress of the elections and watching this in the media on a regular basis. I mean, that's outside of just like regular world stress. And I just wonder if you could comment on that, because I have a number of people that have called in and have met me in the community that they're feeling a bit worn down right now by all that's happening in the world.
Of course, there's going to be things happening like that all the time. Elections will come and go, but life will still have to be on. And I always say that keep family as your fulcrum. There is where you have both sanity and support. So I understand how much of stress it could be to make the proper decision in the elections, and of course the Cubs. You could consider that as a hugely emotional moment, but I think that's the positive drive that we should cling on to and move forwards. The Cubs didn't give up, and after 108 years now, we've got it. So I think that perseverance is what we need to take out of it. The positive energy.
The perseverance is also, I guess, accompanied. I mean, it was a really long playoff thing and a lot of sports watching and so forth, and a lot of poor eating and excessive alcohol intake. How do you bend the curve after all of that?
See, this is where I have a slightly different approach in life. I told you, your family is your fulcrum. So what do you need to do to keep that family happy and healthy and safe? So there are every moment decisions that we make, and I think we need to think a little bit more about our decisions regarding our food intake, even during those crazy periods that you're talking about, emotional roller coasters, and so many other things that you may not even plan for, but you can plan for your family. You can plan for your health, for your safety. That has to take priority.
We're talking to Dr. Mary Telak. She's got 3 locations, one in Whiting, one in Cherville, and then, of course, her main office in Highland. Independent physician around here, doing as by trade an internist, but also doing diabetes and bariatrics and a number of other specialties. But a lot of it kind of centers around living in a healthy way and eating in a healthy way to address many possible health concerns and ones that already exist. Would that be a good way of putting it?
Yes, it's preventive care. So my focus is on preventive care. My focus is on a co-production with the community. My focus is on not that a physician decides what to do, but you and I decide together what would be the best for you and your family. So I kind of strive on these 2 words, preventive care and co-production. So what I am aiming at is how can I get more engagement from you? How can I improve the process where you think that, no, this is an insurance problem, this is a doctor's problem, and no, it's your problem and my problem, and we do it together. So my entire drive for year 2017 is going to be, how can I increase patient engagement in this process?
Good luck with that, because, I mean, obviously this is part of it, doing the show and getting out and talking to many people, and you've gained a lot of patients and a lot of people that, will look at healthcare a little bit differently from you talking about it on a regular basis, getting involved, eating better, knowing your rights, knowing your information, knowing where you're headed, and helping the doctor make decisions. But that only goes so far. You're really dealing with a mentality that I go to the doctor tells me what to do. I go to the doctor when something's wrong, only when something's wrong. And for a lot of hammerhead mill rat mentalities, it's only when something's seriously wrong. So you've already gotten to that point. And then once that is that advice or pills are given going back to the same way that we've always lived after the malady is cured.
No, I beg to differ. I think people have changed significantly. I've been practicing medicine for the last 15 years. This is my 16th year in practice in Northwest Indiana since I left UIC in Chicago. And I will tell you, there has been a huge change in the culture among the people. And I think you are probably one of those that I have yet to change fully. So yes, I agree. There are some of you that I will have a more difficult time to make that change, and unfortunately we'll have to wait until a real calamity happens to make the change. But I don't think the rest are in the same boat. I am seeing a lot more people who want to know more about their illness, their options, what can they do before they get into this process. I am seeing more and more and more of these discussions happening in day-to-day practice.
Well, I beg to differ on two levels. First of all, I do agree with you that there is more openness from local people who may have approached medicine in a different way in the generations gone by. Okay? Mm-hmm. I agree with that. But we just had a guy in here, Dr. Richard Rupp. I don't know if you heard some of what he was talking about. He said when he moved here from the Bay Area, that there was a certain fatalism and unwillingness to accept new ideas around this area. Mm-hmm. And the kind of medicine that you're talking about is accepted in some of the maybe college towns and more progressive areas around America. But to engage in a partnership with the physician in determining the outcome or determining the future of your own health care is an innovative idea around here. And we have an area that resists that.
I'm going to make a proposal. I want you to bring your cameras one day into my office.
HIPAA
and
laws.
See. No, I will get that covered. And I want the people to see what kind of communication is happening. What kind of conversation is happening. I am telling you, it's not true. I agree with Dr. Ruff very much. There were such situations in the past when people did not want to be involved in their health care. But it has now changed. The culture has changed. You don't have to be well educated. You don't have to be young. Every generation now. I have many of the Medicare beneficiaries who are now accompanied by their children who have a much more meaningful discussion about what is quality of life versus quantity of life. We have a lot more discussions now than what we had. You know that the healthcare cost trajectory tells us that most money is spent in the last 6 months of our lives. And that is a wrong thing. We need to take care of it. And I am seeing more and more and more changes in that part. We spend more energy time in preventive care. We spend more time in talking about quality of care towards the end of life. So these are important things that have to change. And I'm actually very excited and proud to tell you that that change is happening now.
All right, in a more personal level, you're like, well, you're saying I'm one that you haven't necessarily changed. That is so far from the truth. If you saw me as a trader eating cheesy pizza and drinking 3 or 4 beers at lunchtime and gambling and staying out and not coming home and living that very stressful lifestyle, this whole life change here of working at the radio station is all part of like, hey, you got to chill out and live a more healthy. There's not a donut out here. There's a pile of grapes. I'd much rather there be 2 or 3 donuts on here as there was 5 years ago.
That's exactly what I mean. So I didn't know you at that time in your life. So I'm not comparing with that. I'm comparing with my first day with you. So that's the delta I'm trying to see. So I still see you struggle with the concept of thinking about healthier choices, thinking about not choosing a donut and beer and not participating in the preventive approach in healthcare. I understand where your mind block is. I totally commend you on the change that has happened from your decades ago on the field to what it is now. But I think there's the change that we are talking about is where you exactly are. If I can find a way to have that change in you, I will be able to conquer the thing that I'm trying to do with the community.
Let's talk to a guy who has undergone a pretty good change. It's Dave from Highland. Dave, you're on with Dr. Mary Telak. What's going on?
feeling healthy as I ever have at 53.
Do you still shaving your chest? You still shaving your chest?
I'm just about everything, Jed, and that's a little too much information for even the doctor. So, hey, doctor, thanks for coming on again. Obesity is just not one epidemic, and I want you to get out of your comfort zone a little bit here. There's an epidemic in Lake County of heroin and fentanyl overdoses. Just to the point, I mean, I think we're over 50 deaths in Lake County this year. There was just another overdose on Saturday, but I believe they brought that person back with a Narcan 10. That's all, again, it goes to preventative. And I know this is a hypothetical, but I trust your judgment. One, can you explain what everyone says a heroin I don't think they know how that ravages the body and the mind, heroin and fentanyl. And if there was this brand new position of Surgeon General of Lake County, what would you do to curb this and save these people? And my last question is for Jed. Jed, you never eat on the radio when you're with Dr. Telak. So maybe you should, 24/7, just keep a picture of her on your desk so it'll guilt you not to eat on the air anymore.
It'd be a little bit creepy, too. All right, good point.
I don't know. She's not a strain to look at, that's for sure.
All right. Well, thanks a lot. Talk to you.
But that's my question about the heroin overdose.
Yes, actually, it's
serious.
Thank you. Thanks for bringing that question. I always admire his interest in healthcare and changing the health of the community. And although I have not talked about narcotic prescriptions, it is something very close to my heart. And we follow certain principles in our practice every day. And that's about narcotic prescriptions. So the fentanyl, he talked about two things: heroin that you get on the streets, and fentanyl, which you get from a physician's prescription. So the culture of prescription drug overdose has significantly increased, and I think the control has to come from our side, from the healthcare provider. Advised every physician writing narcotic prescriptions to do is to run a report called INSPECT, which is a national federal government report, and we will know exactly what prescriptions have been filled by this person, from who are the prescribers. If there is a policy and practices like ours, and many of them do follow that practice, that if the person is obtaining narcotic prescriptions from somebody other than you, we immediately stop writing any prescriptions for that person. So there's a constant evaluation. So it's very difficult for these people then to abuse the system. But the providers have to take that additional step of making sure that they follow those rules and regulations in narcotic prescriptions. Very important. Family members, grandparents are given these prescriptions, and then those trickle down to the grandchildren and the children who are abusing those prescriptions. So I think it is a huge step from a provider perspective, which is what I would like to change among all practices writing narcotic prescription. And this occurs in certain areas. I mean, I have practices in Whiting, Cherville, and Highland. I see a lot more of this concern in my Whiting and Hammond practice than I've ever had in the other two offices. So I have created additional layers where we make sure that this is taken care of, that we prevent such prescriptions that are floating around.
That is on the prescription narcotics.
Correct. And that is the number one drug abuse actually currently.
That is. And we have, the Attorney General, Senator Joe Donnelly. I've had a number of people that will, Lake County Coroner Marilee Fry. A lot of people, we have commented on the prescription drug abuse and the rampant, rise in that.
Yes, and he was asking about how does it affect the body itself.
He's asking specifically about heroin.
Right. All of these can cause breathing depression. So it prevents the brain's trigger to make you breathe. So we are on a constant feedback mechanism. So the brain and your internal functions are constantly being routed, basically. So you are told by the brain to breathe. So if you take out your brain's input to your internal organs, your heart or your lungs, you're not going to have that effort of breathing. So it causes that central block that will cause complete breathing arrest. It can also change the way electricity passes through your heart. I call it electrical rhythm of your heart. So it can prolong the conduction, and hence it can lead to cardiac arrest. So if you lose your breathing and you lose your heart function, you lose your life, basically.
So right now we're talking about, there's a headline number right now of 68 heroin deaths, or 68 overdose deaths. 41 of those are heroin deaths. There's been 9 heroin deaths in the last, 9 heroin overdose deaths in the last 3 or 4 weeks here in Lake County. What could account for the deaths specifically to heroin right now? I mean, is there a change in the heroin? Is there just a rise of people starting on prescription narcotics and then moving into heroin? What's going on here?
No, it is overdose. It's basically, yes, you take heroin. I'm sure it's mixed with other things. Who knows what else is coming with it? And there is no dosing in this. Overdoses happens in places where you cannot calibrate what dose you're taking. So that's what happens. A little bit more is enough to completely depress your breathing and your heart function, and you're done with. So it doesn't have to be a certain change in the way the heroin is being taken down the streets. I think it is mixed with other drugs. There is once you start using these, there's no inhibition. Just like alcohol, any drug of abuse, that's what happens. There is no limit to how much you can take, and you can easily go to the overdose side, after which your internal functions, body functions, do not work.
She is Dr. Mary Telak, 219-845-1100 if you want to talk to her. You can also text in at that time, 219-845-1100. Jed has not changed, asked Ryan. Donuts daily, McGriddles, croissant, breakfast sandwiches, and many silver bullets.
So I'm going to tell you something about this. I know Jed. I don't think I need anybody to tell me about Jed. When my patients, this is the relationship that I've been blessed with anybody that I've come in contact in my professional life. Most of them come to me and they think I can just with a few words know exactly what's happening. I can read them. I will tell them when they have made the change, when they have become partners, when they are struggling to make that change. So I don't need any report about who's eating donuts. Ask my patients. When they come to the front desk and tell my staff, to this visit, I would be okay if Dr. Telak is very busy. I will see my nurse practitioners. And I know immediately that is because they don't want to face me, because they did not do what we had accepted to do. And those are the patients' room I actually go in. And my patients have figured that out as well. So I know when Jed makes the real change, trust me, I will announce it on the radio. And it will be a day to celebrate.
219-845-1100. You do realize that within... we're going to talk to Mon over here for like 5 minutes or something. Within 15 minutes of you and I getting off the air, I'm on that treadmill. I'm lifting weights. I'll probably go for a walk later with my wife. I exercise pretty heavily. Now, if I want to have a couple pops, I don't mean soda. I've cut soda out. All right. That's a huge, I was
changes.
4 Diet Cokes a day, maybe 5. And, then it was down to 3, and now I just don't even drink it at all, and I feel a lot better for that. But, there's certain beautiful things in life, like a really greasy house of pizza, that just cannot be given up under any circumstances.
Yes. So this is what an addict tells me. If I sit down with a cocaine addict or a heroin addict, I hear the same thing. What that particular moment gives them, that moment of bliss. There is no consideration as to what has happened around that moment, what happened after, what happened to their families, what happened to their health. The consequences of that is not taken into consideration when that addict tells me, whether it's about a sugar, whether it's about a greasy pizza, whether it's about cases of beers, no matter what it is, they are all substances of abuse. And when you think about that moment of bliss, think about the consequences from that.
Yeah, because all it means is more, to me, it means just more working out.
No, that's not true. That's absolutely not true. That fat content, that processed food content is enough to create a cardiac arrest in you than what your exercise can negate. So that is where I need to change his mind. So this is exactly the addictive personalities that humans are. And we all have different spectrums in addictive personalities. And this is a beautiful discussion. It's going to go on for years, and I know that. And every time we're going to make changes, and I'm very proud of the changes you have made. I am not the way your friends are. I am a way I listen to my patients and we call them tiny habits. We're not going to do a complete overhaul overnight. It's never going to happen.
Well, that's what I
By
agree.
tiny habits. But I would like tiny habits to then leverage another tiny habit. And I want to control that addictive thought process, the addictive mind behind you. And that's what I'm going to be having to work on.
Well, what you're talking to, by the way, it's the top of the hour, AM 1230, WJOB, and 104.7 FM, also on the TuneIn app. Dr. Mary Telak is in the house. I think we've exhausted that discussion of donuts and breakfast sandwiches, McGriddles, and silver bullets. Let's go to Mary on line 1. Hey, Mary, how are you?
I'm fine. How are you all?
Good.
What are you, from the South? You all?
No, well, South Hammond, if that counts.
How are you? How are you all? It's like U-Haul. What's up?
I have a question. I don't know what the proper name would it be, but what would cause like what I call the shakes? Like sometimes your hands start shaking, and you just feel like you need to eat something to stop that. Like I don't know if that means like you ate too much sugar, or should you have some orange juice or bread?
So that's you've actually nailed the best question. That's what happens when your sugar goes down. So before you become a diabetic, I mean, we'll talk about diabetes. That's another complete day's discussion. But if you are not a diabetic and you think that sugar should not be a problem, which is wrong, what you're explaining is we call it reactive hypoglycemia, meaning because of the carbohydrate load you consumed, the sugar load you consumed, what happens is you drive a particular hormone in your body called insulin. That's what balances the blood glucose. So when you eat carbohydrates, your sugar has to go up and it triggers this insulin response, and it will be proportionate to the amount of carbohydrates that you've consumed and how resistant your body has gotten to the insulin because of the excess body fat. So if you have a multitude amount of insulin in your body, what do you think is going to happen to your blood sugars an hour from then? What does insulin do to your blood glucose? It drives your blood glucose down. So an hour later, your sugars are going down and you feel the down. You don't feel the high, you feel the down, and you're crashing. The only way you can survive that crash is by eating the same compound, the glucose, the sugar, the carbohydrate that created this process. So this is a vicious cycle that most of us who don't eat well are living under. So if you change...
How do you eat, Mary?
I try to eat as healthy as I can, but just every once in a while, unfortunately I have an addiction to sweets. but I try to, temper that with, eating my celery and carrots, and I definitely don't like go gorge on donuts, but I'll allow myself a donut, but I can make it last for the whole week.
No, but can you do me a favor? So from now onwards, I'm okay with you. You already know sugar is not good, right, and you're going to control it, but every meal that you take, do not have carbohydrate by itself. Make sure that there is some protein and some fat in it, because then it slows down the absorption of the sugar. It does not create the highs and the lows.
Okay.
So always have a fat and a protein along with a carb.
Okay. Thank you.
Hey, Mary, just go see her, and then you'll get this in a paid hospital room.
I am really, really seriously thinking of that. I just don't know how to break it to my regular doctor. I don't want to make her feel bad, but yeah.
No, you could have this discussion with your doctor. I'm sure I'm trying to get my physician colleagues as well to understand this. This is something that I need everybody to do. It's not just me. All my physician colleagues, they hear about it too. So don't worry.
Thanks a lot, Mary.
Okay, thank you.
You're
Bye-bye.
welcome.
You got 15 seconds, Mad Mac. Go.
2 questions, Doc. Your little co-host Tubby there, he has lost weight over time so far. He has reduced his weight, hasn't he?
Well, if he comes to see me, I would probably get a chance to weigh him. But I think he has lost some body fat. I would agree with that.
Yeah, the last time he dated me and took me to a movie, he definitely looked skinnier. But I have one quick question.
Oh, Lord.
No. Is it not true that the human body, when we expel calories, whether we're working or running or sitting and watching TV or reading a book or even sleeping, is not the number one thing that our body uses calories is to process the food we eat, meaning that we probably, as humans, we eat way too much food. Is that not correct?
Thanks a lot. Go ahead, quick.
Well, there's a point to it that there is energy spent in digesting food, but it contributes to about 5% of the total energy expenditure. 70% of your total energy is spent in running your body's functions while you are at rest. For your heart to function, your kidneys to excrete, your lungs to breathe, your skin to do its functions, all your cellular function takes up 70% of your total energy expenditure. Digestion is about 5%.
There it is. Thanks a lot. Dr. Mary Telak, thank you so much, as always, for coming on WJOB. We appreciate it. All right, guys, that'll do